I want to talk with all of you about a topic that everyone, I think, cares about a great deal. I know I certainly do. Today's Vietnam Veterans Day. It's a chance to acknowledge the service of those who fought in Vietnam, in particularly difficult circumstances, to remember those that were injured, those lost, and those who still carry scars from their service. But sincerity in that thanks also means we have a duty to properly care for our veterans in their life after service. But it doesn't look like that's happening at the moment. The ever-increasing demand for mental health services under the NDIS has had the unintended effect that veterans are being forced onto months-long waiting lists to get mental health support. Part of the problem is that the veterans support system is paying less than the NDIS does for the provision of what is essentially the same service. At least $61 less per session than NDIS clients. Now, for most Australians, there is an enormous amount of goodwill for the NDIS and an acceptance that it plays an important role. But when you hear that it's starting to hamper veterans' mental health services, well, something's very wrong. Joining me to discuss this is a veterans advocate and veteran himself, Ryan Shaw. Ryan, thank you very much for your time and, of course, for your service to the nation. Tell us what's happening to veterans right now in their ability to access mental health services and the impact that this situation is having on them and their families.
Thanks for having me on, Amanda. It's clear that many veterans can't access mental health services because of complex legislation and significantly underfunded rates. On top of that, we have other social services outbidding veteran care services. And many of our veterans are grappling with exacerbated mental health conditions. And this is due to a system that is pushing them down the priority list to access the vital care services. We look at the NDIS, in some cases, people are afforded the flexibility to increase the amount they pay for a service or fee. And that has a significant effect which eclipses the veteran's ability to access those services. And if we look at some of the psychological wait lists in Australia, some of them are extending into next year. And the people that I'm speaking to have informed me that they were told they've got to wait upwards of 6 weeks to get access to mental health support. And with an average time of 6 weeks, imagine being in a mental health crisis and being left to fight in the trenches alone because of wait lists or fees. And I'd say the government has a clear responsibility here to put in place better systems to ensure our veterans have access to the services they need now, not in 6 weeks, not in 12 months, but right now.
Yeah, it's pretty scary to think that a mental health problem could be made so much worse simply by the process and the bureaucracy associated with getting access to the help that's needed. Ryan, have you spoken to the government about this concern? And if you have, what did they say? Did they take it seriously?
I certainly have, and none of this is a secret. There is some very revered organisations out there in the veteran community that speak on this in great detail. And certainly the peak bodies associated with mental health services in Australia have acknowledged that the standard mental health service fee is almost double what the Department of Veteran Affairs has scheduled for. And surely this hasn't escaped the attention of the current government, because it's not just a discrepancy in numbers, it's a profound failure in their capacity and commitment to provide services for veterans.
And it's an effect that the NDIS is having across a range of the personal services that are often supplied as part of people's packages. Very quickly before we go, because we don't have much time left, Ryan, it's Vietnam Veterans Day today as the nation marks 50 years since Australia's involvement in the Vietnam War ended. How can we honour their service into the future?
There's actually a lot of commemorative services occurring today, in the later part of today. I spent my day today with some Vietnam veterans, and no doubt they're continuing their commemoration and catching up with each other over a few beers. But if you are a Vietnam veteran or know somebody who's a Vietnam veteran, the Department of Veteran Affairs has released a medallion to commemorate the some 60,000 men and women who served. and the 50th anniversary, and I'd encourage them to jump online and go on there and put in their application for that medallion. Otherwise, look on your local RSL. They're certainly advertising some of the later commemoration that's occurring over this weekend in honour of the 50th anniversary.
Good on you, Ryan. Thanks very much.